Good afternoon, friends. I am Dr. Sumit Goyal. I am Head of Neurointervention and Senior Consultant of Neurosurgery at PSRI Hospital, Saket, New Delhi. Today we are talking about aneurysms of blood vessels. So, aneurysm is basically a focal dilatation of the blood vessel, this is a weak area of blood vessel from where the blood may rupture and leak. So, I would be specifically talking about brain aneurysms. Brain aneurysms are the focal dilatation of the blood vessel inside the brain, and these are one of the things which are responsible for one of the brain hemorrhages, which is medically called as subarachnoid hemorrhage. Now, subarachnoid hemorrhage is a neurosurgical emergency. It is a life-threatening condition to the extent that you can understand that 15% of the patient may not reach the hospital even just after the first hemorrhage, and if there is a repeat hemorrhage because of the blood leaking out of these aneurysms, the mortality may go as high as 50%. So, whenever the patient has a rupture of brain aneurysm inside the brain, they would have a sudden onset severe headache. This headache would be one of the worst headaches of their life, classically described as a thunderclap headache. This is associated with vomiting, nausea, sometimes loss of consciousness, seizure, paralysis on one side, or it may directly lead a patient to on a ventilatory support. These patients require immediate intervention as early as possible. Whenever we get these patients, it is a routine to perform a CT scan or an MRI followed by an angiography, which is done through a catheter putting into the groin, which is taken into the neck arteries there. Then, depending upon the shape and size of the aneurysm, the treatment can be either in the form of surgery, where you can open and put a clip on the aneurysm, or you can do a coiling of the aneurysm, where you take the wires through the catheter from the groin and you put coils inside the aneurysm. So, this is a minimally invasive method to treat this lesion. The idea is to block the aneurysm so that they do not rupture again. My friends, just to emphasize that this is at times we commonly say that this could be a ticking time bomb inside, because if you have an aneurysm which is leaked, there is a very high probability that it could leak again. So, if somebody who has experienced these symptoms, this is one of the conditions that needs to be definitely ruled out so that rightly treatment can be provided on time. Now, with the advance in medical diagnostics, we are at times seeing patients which are diagnosed with the aneurysm and we catch them in an unruptured state. That is, the aneurysm was there, but the aneurysm is still not ruptured. So that is where we have to take a very careful decision that do we need to treat these aneurysms. At times you don't need to treat all the unruptured aneurysm, and this is a very careful decision that your neurosurgeon can take in consultation with you after explaining you all the pros and cons involved in this. So, just to conclude, brain aneurysm is a neurosurgical emergency, but timely treatment can prevent a major mortality and morbidity. Thank you.